Hello, everybody. We are Thursday, October 1st. Happy October. And I wanted to let you know that we do have a Flex Alert. It is a statewide Flex Alert, and it will go through 3 p.m. to 10 p.m. today. And the number you can call for more information is 800-655-4555, and that's Laguna Woods Village Alerts.com, where we will have information regarding that. So statewide Flex Alert till 10 p.m. tonight. Okay, we have one meeting to tell you about, is the United Agenda Prep meeting. That will be at 2 p.m. today. And you can always follow along with lagunawoodsvillage.com/meetings. Now on our show today, we have RadNet. We have Dr. Tung, who is here to talk to us about a variety of different things regarding, actually it's BreastLink/RadNet, Dr. Tung. And then we've got Kaiser Permanente. Open enrollment starts this month, and that is with Ellie Rosamilia. And let's go ahead and go give you our resources like we normally do for COVID-19. COVID19.ca.gov. You can follow along with the governor's reopening plans and get all the information regarding that. OCHealthInfo.com, where you can get all of the numbers per city. Of course, they have a hotline, 714-834-2000. Then you can also go to our website, which is LagunaWoodsVillageAlerts.com, where you can get all the local information. And of course, if you have a question or a comment, you can always email that to info@LagunaWoodsVillage.com. Now, as I mentioned, we do have a Flex Alert today, so it is going to be quite warm. I believe there was a Flex Alert yesterday, and it got pretty warm yesterday as well. We are looking at temperatures in the high 90s throughout the week. And then into the weekend, we will be looking at cooler temperatures starting maybe around Sunday. So today it's going to be very hot. It's 93.69. Tomorrow, 92.67. Very hot on Saturday, 90. And then we start somewhat of a cooling trend by Monday, 85.65. Now, our sunrise this morning was 6:46, and then our sunset at 6:34. Now, here is a beautiful photo of this blue bird, and this was sent in by Mark Rabinowitz. Mark, thank you so much. You always have such a wonderful selection of photos. Now, what we'd like to ask for you guys to do this month is to send in photos of an animal. It could be your pet. It could be an animal that you have out in the yard. I know Alan has sent us some squirrels in the past. So if you guys have a special picture of your pet, please email it to LagunaWoodsVillageTV@gmail.com. All right, stay tuned, and we'll have Dr. Tung when we come back.
Achieve a level of comfort you've never known before. The Daydreamer will take you through smooth movements and guide you effortlessly into your favorite positions. Adjust the power pillow for ideal support for your head and neck. This and our positioning technology allows for infinite relaxation. Lay back in zero gravity while watching TV and put your body and mind at ease. Lift your spirits and find your favorite daydream. Contact your local Golden retailer today.
Hearing aids require a lot of attention. Don't underestimate the problems earwax can cause. Come in and see inside your own ear canals to find out how much blockage you have. Debris like earwax can cause up to 45% reduction in amplification. Your hearing aids may be able to be significantly improved to help you hear conversations clearly with a simple office visit. Every day, patients say, "Oh my gosh, that sounds so much better." Stop in or call us today for a complimentary cleaning and ear inspection. Tell them Stuart sent you.
Welcome back. Well, today I am joined by Dr. Sean D. Tung, and he is here on behalf of BreastLink RadNet. Well, welcome. It's very nice to meet you.
Nice to meet you too, Lisa. I'm glad to be here.
Now, during this pandemic, which has lasted, I think, much longer than most of us really had thought was going to happen, many people had so many concerns about going in to get their mammograms and just their regular doctor visits. What were some of the challenges that you saw during that time frame?
Obviously the biggest challenge is what to do in regards to safety around this pandemic. How can we care for our patients? How can we offer treatment, or in the case of breast imaging, just imaging in general, to patients without putting them at risk? This has been a challenge for pretty much everyone in the world. And I think that at least here at BreastLink and at most RadNet facilities, we have done a pretty good job of mitigating that risk. And just to name a few things, during the height of the pandemic, we were really limiting the number of people that were coming through our doors, and still are to a great extent. Screening patients, making sure that the people that are coming in are at least not symptomatic. Of course, the asymptomatic carriers are the ones that we worry about, because obviously we don't know and they don't know that they potentially may be a carrier. And that's where our mitigation strategies kind of come into effect, making sure that we kind of keep patients separated. For a lot of patients, we're asking them to stay in their cars until their appointment time is ready. So just kind of sticking to the guidelines that the CDC, the WHO have put out, and kind of creating our own ideas of what works for us in regards to keeping patients safe. And I think we've been doing a pretty good job of that. Simple things like cleaning each room between visits, mandating masks in the office by all of our staff as well as patients when they come in. When we see patients, we try to limit who's in the room with us to the patient themselves.
No, and that's great. And we've talked to so many different people with RadNet and BreastLink, and overall, it's been nothing but at the highest level of safety, which I think is really awesome. And now, if a woman puts off, going in for her breast screening, what are some of the outcomes?
So I think that's a very interesting question. It's something that, now that we're going through this pandemic, we're going through a situation where there was a portion of time where we told patients that are healthy, who don't have issues, who are low risk, to maybe go ahead and put off your screening for a few months at least. And I think for the most part, patients who are at low risk, who don't have something that needs to be watched, for instance, a lesion in the breast that was seen maybe 6 months prior to the pandemic and needed a follow-up. For those cases, though, case by case, obviously those are situations where we may want to see someone right on time. Otherwise, I think healthy patients, having to wait an additional 3 months, although ideal, 3 to 6 months is not ideal. I don't know that it will create a very big negative outcome on their care. There are some patients who, for whatever reason, will miss their appointment for 3 months, or miss their appointment for 6 months, or miss it altogether for a year, and the follow-up mammogram will still be benign. However, that's not something that we want to really kind of live by. In this scenario with this pandemic, we have been limiting the patients that are coming in, at least in the beginning. And now we're starting to see a backlog of those patients starting to show up. Will there have been a number of patients who potentially have a lesion that would have been caught a few months in advance? Absolutely. Obviously, that is a concern. However, so far, I haven't really run into patients where I feel like something has changed dramatically over the past few months that could have been prevented had they been seen earlier. I think for the most part, the patients who have an issue, who feel a lump or did require a short interval follow-up, I think those patients have reached out to us and we've given them good guidance about what to do. And for the most part, we have still been seeing patients throughout this pandemic, but being a little bit more careful about deciding, okay, who do we want to see right away and who can maybe wait a few weeks.
Right. And that's good, because one of the questions was, are you seeing an increase? And that's good to know that you're not. At this point. And so hopefully that will still remain the same going forward.
One thing I'll add to that. So now we are starting to see a larger number of patients, but I believe that is a function of the number of patients that kind of put off their follow-up. So does that track forward? Is that pulled forward from cases that we would have seen a few months ago? I think that's probably the case. And to kind of speak to your last point there.
Okay, perfect. And then how do you determine which breast cancers need to be operated on and which ones can wait?
So that's another excellent question, and that's a question that was brought up by our national body, the American Society of Breast Surgeons, amongst other oncology groups. Several months ago, a paper was released describing exactly what to do in these types of situations when we are in a situation where our resources are limited. PPE was limited, not only for the frontline workers, but as you can understand, as a surgeon, well, a lot of that same PPE is used in the surgical operating room. All the sterile equipment that some of the frontline workers would need, we also share. So there was a big push to kind of put off elective surgeries, especially in March and April, and we were given some guidelines to do that. Now, I always tell my patients that although breast cancer is not necessarily a medical emergency, it's definitely a mental emergency, and it's not something that people want to just kind of put off. Definitely not elective, procedure in regards to black and white definition. It's more of in a gray area between emergent and elective. They're urgent procedures in my eyes. And a lot of the facilities were allowing us to continue doing these operations. However, we did take into consideration for patients that we felt were, had more favorable disease, that we could potentially put them on medication preoperatively to kind of, basically keep the disease at bay and potentially maybe even shrink the disease a little bit, which we have seen in some of the patients that we put on these regimens preoperatively. But now we're returning to more of a normal workflow where we are taking patients in to the operating room in the same fashion and timeline that we would have prior to the pandemic.
Okay, well, that's also very good to know, because I know people were very concerned there for a while. And
Absolutely.
Now as we're moving back into somewhat of a new normal for us, we're getting to where we need to be. What advice would you offer to our viewers that might be confused about the medical care that they would receive during this time frame?
Lisa, that's another great question. It's an especially tough time in our country where, depending on where you look or who you listen to, we're constantly getting contradictory information. And so what I think is the most important thing for patients to understand is that if there's something that's going on with them that they're unsure of or they're worried about, at least you can put a call into your provider. Many of us, if not all of us, are now offering telehealth medicine visits. So at least you can get on the phone with your provider, maybe even one of the nurses in the office that you go to, at least to kind of let them know what your concerns are. And then that will give us a heads up about what's going on. And we can at least reassure you if it's something that we think, hey, if you don't feel comfortable coming in, I think it's something you can wait for. Or, hey, this is something I think that we should figure out, we should work up, and then we can bring you in. And again, I will reassure those patients, touching back on those mitigation efforts that I had mentioned, really letting patients know that as physicians, we understand this pandemic better than anyone, and we really are taking the appropriate steps so that we can continue to care for patients. Speaking for my specialty, cancer doesn't take a break for pandemics. Cancer doesn't take a break for elections. Cancer doesn't take a break for anything. And we want to be here for our patients to be able to provide for them in a time that's going to be very, very high anxiety for them, very worrisome time for them, and be able to provide at least some reassurance on the phone. And if there needs to be an in-person follow-up, we can definitely set that up safely for them. The key here is to just reach out to your provider, have an open line of communication, and express your concerns. And I'm sure that, like we do here at BreastLink, they'll be able to take care of you.
Excellent. You said it very well. I appreciate it. And thank you so much for the information, because I know that people are really still a little worried, especially our community who are of the higher risk. So this kind of information is exactly what they need to hear. So thank you so much.
My pleasure, Lisa, and to all your viewers out there. If you have any questions about breast health or breast concerns, even a question, you don't necessarily want to come and see us, give us a call. We can at least, at worst case scenario, provide some reassurance for you.
All right. Thank you very much.
My pleasure. Take care, Lisa.
And we'll be right back after this.
Ernest Hemingway wrote The Old Man and the Sea at 52. Satchel Paige was still dominating batters at 59. Celia Cruz was still winning Grammys at 77. John Wheeler illuminated our ideas of the universe at 70. And Roger Crouch was 56 when he first went into space. Your best is yet to come.
Welcome back. Well, today I am joined by Ellie Rosamilia, and she's here with Kaiser Permanente. And it's that time of year again where we're going to be talking about open enrollment. Ellie, thank you for joining us again. It's been a while.
Yes, it has. Thank you for having me.
So I know you're going to be very busy coming up in the next few weeks regarding open enrollment. So I'm glad that you were able to join us and give everybody a good idea of what maybe some changes are or some things that they need to do. So why don't we start out with just talking about the 4 parts of Medicare. Is everything the same or is it different?
You know, it's the same. Lisa hasn't changed. So there's 4 parts of Medicare. Original Medicare is your Part A, which covers hospitalization. Part B covers your outpatient services. And then you have Part C, which is the Medicare Advantage program. I like to call it your choice. You get to select a Medicare Advantage to go along with your Medicare Part A and Part B. And then you have your Part D, which is prescription drug coverage. So nothing has changed. Everything has been the same.
I know you've been doing this for a really long time. You know, many people come into, their age availability of being able to do Medicare. What's the hardest part to understand?
You know, they get bombarded with a lot of information. 3 months before your 65th birthday, you must apply for Medicare Part A and B. And then once you get your Medicare, you're able to make a decision of what healthcare insurance you'll be selecting. And I think they get bombarded with a lot of information. They try to read as much as they can, but sometimes making it very simple. We do have webinars, educational webinars to talk about the ABCs of Medicare and making a selection very simple and convenient to you.
Oh, that's really good to know. Where should they go to see that?
So my microsite, or they could call me directly. We are having webinars starting October 6th throughout open enrollment. As we know, open enrollment is right around the corner. It starts October 15th. At that point, they're able to change, to add, or switch their HMO if they would like to.
Oh, okay, good. So let's talk about Kaiser Permanente's Senior Advantage.
Yes. So we have one simple plan. We make it very simple for our members and prospects. This plan is a 0 monthly premium and has minimal co-payments. For example, if you need to see a doctor, you pay a $5 co-payment. If you need to see a specialist, it's $15 co-payment, and there'll be changes. Of course, after October 15, we'll be able to talk about those changes. But we're very proud to say that Kaiser has always kept a very simple Kaiser Permanente Medicare Advantage program for our members.
Yeah, that is awesome. And I know you have received awards, and I think I see it right behind you there as the 5-star rating.
Correct. Yes. We are so proud to announce that Kaiser for 9 consecutive years, 9. Kaiser has received 5 out of 5-star rating. And because of that, we have the privilege of enrolling individuals all year long. So for example, if someone has their Medicare Part A and Part B and they're not happy with their provider or they're not happy with their HMO, they could change to Kaiser as soon as October 1st. They don't have to wait till 2021 to enroll.
Oh, that's good to know. That's great. And what are some of the other things? Like, what do they take a look at as to how you receive the 5-star rating?
Well, they're the center of CMS, which is the federal government. Every year they assessed all the 5-star ratings and all the HMOs, excuse me. And because when you, so again, the 5-star rating, they're assessed by patient satisfaction, how well they take care of their members, all those categories. There's about 50 categories, and you could also find more information on Medicare.gov. Medicare.gov gives you exactly all the qualifications for a plan to receive 5-star rated, but we're very proud to say that Kaiser has been the only 5-star rated here in California.
In California?
Yes.
Wow, that is impressive. Congratulations.
Thank you.
Good. That's really good. Now, Kaiser Permanente, I know in the past we've talked about their integrated systems. Can you kind of go over that and how it works with Medicare?
Absolutely. So Kaiser has a very unique way of delivering care, and that's called the integration system. It allows the health plan, the doctors, the specialists, the hospitals, they all work in a coordinated fashion to give our members the quality of care that they deserve. We have a robust medical record that allows all your doctors to be able to log on, look up your lab results, communicate with your specialists. So there's a constant communication there.
And what if you move?
To a different area?
Yeah, to a different area, yeah.
Correct. So if you do move to a different area and there is a Kaiser, your medical records will follow you too.
Oh, okay, good. So they would be able to access them, what, online?
Correct.
Okay.
We have a My Health Manager that allows you, the member, to go on there. You could look up your lab results. You could email your doctor. Sometimes we get a lab result, we're not sure what it means. It gives you a definition of the test, the values. So our members have that tool to use at home.
Oh, that's excellent. And that's just something that they could just log in?
Correct.
And
Yes.
once they become a member?
Correct.
Okay, great. And then one last thing is how do you individually enroll into the Kaiser Permanente Senior Advantage Plan?
So very simple. They must have Medicare Part A and Part B. Mm-hmm. They could call me directly. Of course, with the change of circumstances that we're going through, we are doing video visits. They could call me. We do face-to-face, but video telephonic appointments. So it's very simple to get enrolled with Kaiser, as long as you have your Medicare Part A and Part B.
Right. Okay. Excellent. Well, gosh, thank you so much. It's very nice to visit with you again. And I look forward to seeing you. Maybe we'll see you sooner than 1 year.
Absolutely. Absolutely. I look forward to seeing you too, Lisa.
All right. Thanks again.
Thank you.
And we'll be right back after this.
Have you been struggling with swelling, aching legs, and varicose veins that keep you from being as active as you once were? Using the latest in advanced techniques such as VenaSeal, Golden Coast Dermatology Skin Cancer and Vein Center offers minimally invasive treatment with better outcomes and quicker recovery times. Dr. Tidwell is an expert in vein care and can help you get back to having healthier and active legs. Golden Coast Dermatology. Call today to schedule your appointment and get back on your feet.
Cups, plates, burgers, chips, masks, outdoor air, 6 feet of distance, as few people as possible, and plenty of hand soap. Make sure lowering the risk of spreading COVID-19 is on your list for your next small gathering.
Do your part to lower the risk.
Back. Well, a couple of things we wanted to mention to you is this week you should be receiving your ballot. Now, your vote counts, and they want you to say yes to clean up the mess. So you want to vote as soon as possible. The ballot box deadline is November 2nd at 5 p.m. And there is an email address if you have any questions about, what this is all about, what the ballot is all about. You can email any questions to nomess@lagunawoodsvillage.com. You could also call them at 949-354-4199. Now, there will be a rebroadcast of the town hall meeting that they had, and that will be October 6th at 1 p.m. right here on Village Television. All right, then also we wanted to just remind you for your regular voting, obviously we're going to be voting for a variety of different things. Your online registering to vote is October 19th. By mail, you need to send that in by October 19th. And then in person, of course, it's November 3rd. Now, there is a conference that's coming up, And it is put on by Hogue, and it is a virtual meeting, so to speak, and you're going to go to hogue.org/VR 2020 for all the information regarding this. It has the agenda. It's going to be held on October 9th from 8 a.m. to 5:30 p.m. So that is a long day. So you want to go to their website to find the agenda so you can see all of the different categories that they're going to be talking about. Of course, as we had interviewed Dr. Robert Lewis in my Your Health show this last month, and we're going to do it again because he's going to talk to us at length about how they use augmented and virtual reality with pain management and a variety of other areas of their hospital. All right, let's go ahead and take a look at our weather. It is looking very hot, and we do have a flex alert tonight from 3 p.m. to 10 p.m., and so it is going to be quite warm. Today we have 93-69, Friday 92-67, then 90-66, Sunday 86-64, and then we begin a cooling trend on Monday, 85-65. And don't forget that we would like you to please email us at Laguna Woods Village TV@gmail.com any wonderful photos of your pets or animals, because that's what we're going to do for this month. Have a great day in the village. You can rewatch our broadcasts at 12:30 and 5 p.m. We'll see you again tomorrow at 9. Stay healthy. Bye-bye.
In a time of need, it's more important than ever to have caring professionals around you that exemplify kindness, compassion, and empathy. Alethea Home Care is a non-medical, family-owned company aiming to improve and maintain the quality of life for our clients and their families. We work hard to ensure your loved ones are safe and comfortable in a warm and familiar environment. Located right here in Laguna Woods, our services include companionship, light housekeeping, respite care, hospice support, transportation, and so much more. Spoil your loved ones with quality care and call today.
Over 25 years, we have worked hard to make Brilliant Smile the premier dental office in Laguna Woods. We take the extra time to understand our patients' special needs and always perform the highest quality dental work at affordable prices in a relaxing and friendly environment. There is no need to refer our patients to anybody else. We perform everything from cleaning all the way to the implant and sinus surgeries all under one roof. Stop in or call and experience the Brilliant Smile difference.
RadNet is the nation's largest outpatient medical imaging network, providing thousands of imaging procedures each day. RadNet has recently been asked by local hospitals to help provide outpatient imaging services for their patients, and RadNet is committed to supporting those needs. We are available to take your calls and schedule your appointments. To schedule an appointment online, visit myradiologyconnectportal.com or visit our website at radnet.com.
As Orange County's highest-ranked hospital, Hogue is the place to turn to for timely information, reassurance, and care in these uncertain times. Our dedicated physicians, nurses, and staff stand ready to safely deliver world-class care, just as we have for nearly 70 years. This is what we do. We are here for you, and we will overcome this together. To access Hogue for all of your healthcare needs, visit hogue.org/trust.
Tip. Toss. Take action. Don't give mosquitoes a fighting chance.